Welcome to Global Nurses YouTube channel. Kindly subscribe, like and share the video. Note, all correct answers are highlighted. 1. What statement describes an example of working collaboratively? A. Work independently and work out the problems alone. B. Provide occasional assistance to others. C. Sharing information when asked, sharing knowledge with others. Two. Glen has a life-threatening illness and asks for information on end of life. The nurse is not comfortable discussing this, but would like to learn. How do they respond? A. Tell the patient they would like to ask a colleague to do this and ask if they can be present. Three. What is a nurse's responsibility when faced with an unfamiliar clinical procedure for the first time? A. To identify their scope of competence with the patient. B. To identify their scope of competence to the ward manager. C. To refuse to undertake the procedure. Four. Elderly abuse can take many forms. Which one of the following would not be a safeguarding issue? A. Sexual abuse, neglect. C. Self-harmed, financial abuse. 5. A nurse is taking a prescription over the phone from a patient's prescriber. Protocol states that nursing staff must check and confirm the prescription, but a colleague is on a break and the nurse is alone. What action does the nurse take? Six. What action does a nurse take if they receive a social media request from a patient? A. Accept the request once the patient has been discharged. Refuse politely and say that it's against the law to accept. Refuse politely and explain that it is against the professional code to accept. 7. When assessing a 15-year-old who is experiencing acute alcohol withdrawal in the emergency mental health unit, which statement demonstrates adherence to NICE 2017? A. For young people under 16 years who are in acute alcohol withdrawal, offer admission to hospital for assessment. Eight. Which of the following will not be a suicide risk factor? A. Alcohol or drug abuse, disengaged from services. C. Lack of social services. D. Female gender. 9. A female patient complains of dysmenorrhea and is prescribed ibuprofen for pain relief. What condition indicates close monitoring once the medication is administered? A. Asthma, aspirin allergen. C. Dementia, diabetes. 10. Hand gel should be offered to visitors to the ward at what stage? A. Before a hand wash. B. As they enter, when they have a drink. D. Before they sit down. 11. Which statement describes clinical governance? Adopt the term for the quality assurance and continuous quality improvement framework in each healthcare organization. B. The way that team meetings are structured, the structure of the senior leadership team. A patient is pyrexial post-surgery. Which one of the following is best evidence-based practice? A. Ensure a thermoneutral environment, observations, and escalation as per National Early Warning Score. News to B. Direct fan therapy whilst the patient is hot and take. Which one of the following activities by a nurse demonstrates individualization of the nursing care plan for a client? A. Writing the care plan instead of taking it off the computer. B. Selecting a nursing diagnosis that matches the client's problems. What does health promotion enable people to do? A. To increase visits to health professionals, to increase control over their own health, to help other people with their health choice, to increase knowledge of health conditions. Strength-based approaches are used in health promotion. What do they focus on? A. Personal goals to aid future planning. B. Personal strengths to gain financial stability. C. Personal ideas about future health needs. Personal strengths to aid recovery and empowerment.